There's a new virus sweeping through China and slowly spreading throughout the world. This virus, called novel coronavirus, has health authorities on high alert. It's not just because the virus has infected thousands and forced millions to be quarantined, it's also because this particular virus has never been seen before. The novel coronavirus is a member of the coronavirus family. Like other coronaviruses, it has come from animals. It's believed that the source was actually a seafood market in Wuhan, which also sells wild animals. We've known about coronaviruses for over 50 years. Some can cause no human disease, while others can cause a variety of respiratory illnesses. Coronaviruses can cause a range of symptoms, including runny nose, cough, sore throat, and fever. Coronaviruses are believed to cause a significant percentage of all common colds in human adults and children. But there are other previously known coronaviruses that are not so benign. The two major ones are SARS coronavirus and MERS coronavirus. SARS outbreak occurred in 2002 in China and affected around 8,000 people, out of which around 800 people died. MERS outbreak occurred in Saudi Arabia in 2012 and affected around 2,500 people, out of which 850 died. The newly discovered novel coronavirus was first observed in mid-December when multiple cases of a respiratory illness occurred in Huanan Wholesale Seafood Market in Wuhan, a city of 11 million people. On 9th January, the World Health Organization confirmed that the outbreak is caused by a new coronavirus, and on 11th January, first death was reported. The first case in the United States was reported on 21st January in Washington state, occurring in a traveler who had recently returned from Wuhan. The novel coronavirus was initially believed to spread only from animal to person, but now it's believed that person-to-person spread is occurring. Coronaviruses in general are spread through close contact. The virus is primarily spread through a sick person coughing or sneezing on someone. A person could also become infected through contact with virus particles on a surface like a doorknob or a train handle. The incubation period, that is the time from exposure to developing symptoms of the virus, is between 2 to 14 days. The virus causes pneumonia. Those who have fallen ill are reported to suffer cough, headache, runny nose, fever, and breathing difficulties. In severe cases, there can be organ failure. There isn't any treatment available at all. As this is viral pneumonia, antibiotics are of no use. The antiviral drugs we have against flu do not work against it. Vaccines take years to develop, and since this virus is brand new, researchers will have to start from square one. People haven't had a chance to develop the natural immunity they will need to protect themselves if they become infected. That means hand washing and masks are the best options. The Center for Disease Control recommends washing hands with soap and water before eating, after using the bathroom, and after blowing nose, coughing, or sneezing. The use of N95 masks can prevent the spread of virus from one person to another. In China, where the most cases are, it's the old people who are ending up in the hospitals. Elderly people or those with existing respiratory or immune problems are most vulnerable to this outbreak. The patients are usually over 40 and the youngest person diagnosed is about 14 years old, so it doesn't appear to be affecting small children. The people who have died already had some underlying conditions. They had certain conditions like heart disease or cancer. Therefore, healthy individuals shouldn't be worried about the novel coronavirus. As of 27th January, the virus has killed 81 people and infected at least 2,700. The virus has spread to Chinese cities like Beijing and Shanghai, and to other countries including Singapore, Thailand, Japan, France, United States, and Canada. On 23rd January, a quarantine on travel in and out of Wuhan was imposed in an effort to stop the spread of virus out of Wuhan. Chinese authorities have imposed lockdown measures on 15 cities in effort to contain the outbreak of the novel coronavirus. More than 56 million people have been affected by travel restrictions. Multiple countries have closed their borders with China. This outbreak has a death rate of around 3% compared to 10% death rate of SARS and 35% death rate of MERS. According to CDC, the risk of novel coronavirus to the American population is low. Currently, there are 4 reported cases of novel coronavirus in the US. Coronavirus can be easily prevented. People feeling ill should immediately see a doctor and stay away from public places. There's absolutely no need to panic about the novel coronavirus outbreak. In fact, you're more likely to die from influenza or common cold than the novel coronavirus.